So my name is Sade, and I'm a community relations manager with Science Care. So every day I'm out talking to community members and healthcare providers and educating them on body donation. When we do discuss donation, most people think organ donation, or maybe they think donation with a university where the body would serve as a cadaver in a lab. They don't quite understand that Science Care is a really unique program that allows someone to donate the body for medical research and education, and that allows us to cremate and return cremated remains to the family within about 3 to 5 weeks. For individuals who are registered organ donors, if that's something they're really passionate about, they probably don't even realize that they can donate organs for transplant and still be a whole body donor for research and education. One of the great things about Science Care is that most everyone will qualify. Age isn't a factor. I would say religion, nationality, race, sex, those are not factors either. Anyone considering cremation or who's passionate about being able to give back, this could definitely be an option for them. I don't think people realize how important body donation is. It really makes a difference for all of us. So our donors go towards medical research, device development, and continuing education and training for physicians and surgeons. One whole body donor could potentially serve up to 5 projects with Science Care. When someone's ready to make final arrangements with Science Care, they can actually call us at or after time of passing, and we even have a special program where they can call us beforehand. The special pre-screening that we have is known as our HOPE program. We actually developed this in conjunction with hospice providers who really needed to know if a patient could be a donor before time of passing. This means if someone is under hospice care or actually has been diagnosed or received a terminal diagnosis, they can call us ahead of time to participate in the phone screening call. The Science Care donation process is incredibly simple. We're available 24/7, so you would start by giving us a call, whether that's to participate in the HOPE pre-screening, where you're giving us a call before time of passing, or calling us at time of passing. During this call, it takes about 15 minutes. We're gathering medical history information, determining where the loved one is located, and also determining if we can place them with current researchers and educators. Next, after we've determined we're able to place their loved one, we start coordinating consents and gathering information that we'll need to file the death certificate. After we've completed the screening, coordinated the consents, we have to dispatch a local provider. Transportation arrives within about 1 to 2 hours. So just remember, it's no more complicated than calling your local mortuary. It's just that now you're calling Science Care and we're contacting the mortuary on behalf of the family. Lastly, after the donor comes into our care, we will take care of cremation and returning the cremated remains. I think Science Care has done a really great job with actually servicing the family. So yes, the cremation is no cost, the donor benefits medical research, advancing healthcare, but there's also some things we do just for the family after the fact. 1 month after donation, the family does receive what we call a family follow-up letter. And that details the research projects that were going on at the time their loved one donated, so they can really see the impact that their loved one made. In addition to the family follow-up letter, I think our donor families really appreciate that we also plant a tree. It's called our Memory in Nature program, and this is where we send a certificate letting the family know that we planted a tree in their loved one's honor. This happens on the 1-year anniversary of donation. We have a really helpful comparison guide online. It details burial, cremation, whole body donation, and university donation. It's extremely helpful if someone maybe isn't sure if a family would be open to this. It clearly just lays out all of the options so they can make an informed decision. But we also have Facebook, and that's where families are talking to us directly. Sometimes it's immediately after they've received their loved one's cremated remains. I think it's extremely helpful. It builds a sense of community that all of our donors know that other people are choosing this as well. And for anyone thinking about donation, it helps to see what this meant to the family and how it worked. We know not everyone is familiar with body donation, so there's a lot of information just about understanding how our program works, but there are probably 5 things that are most important. It's a simple and easy process. We are available 24/7. Most individuals will qualify, and you can give us a call before time of passing or at time of passing. And lastly, the entire program is at no cost to the family. If you have a patient or family you think would be interested in donation, you can give us a call at any time at 1-800-417-3747 or visit our website at sciencecare.com.